We will now walk through the otoacoustic emissions OAE screening process step by step. First, we'll do a visual inspection of the ear. As a reminder, the 4 reasons not to screen listed in Arizona's hearing rules are blood, fluid, or drainage from the ear, earwax that may be occluding or blocking the ear canal, open sores on the ear, or a foreign object in the ear canal. If any of these conditions are present, the child should not be screened and their parent or guardian should be notified as soon as possible. If ears appear healthy, proceed with the OAE screening. Learning how to select the right size tip and how to insert the probe firmly into the ear canal is key to reliable screening. Note the size of the ear canal and choose a probe tip that is as large as or slightly larger than the ear canal opening. Place the probe tip over the end of the probe, pressing down firmly until it is flush with the base of the probe. Clip the probe cord to the back of the child's shirt so it is out of the way. This will also help keep the probe in the ear during the screening. With one hand, gently pull up and back on the outer ear to open the canal. With the other hand, gently insert the probe tip into the ear canal, angling it slightly forward and down toward the nose. If you're using a soft foam tip, roll it between your fingers to compress it before inserting it into the ear canal. Push it firmly into the canal with a slight twist. It should fit snugly and comfortably just inside the ear canal. After placing the probe in the ear, always let go. If you've chosen the correct size probe tip, the probe will stay firmly inserted in the ear canal after you let go of it. The probe should never be inserted deeply into the ear canal. With the proper tip covers, the probe cannot extend deeply enough into the ear to touch or damage the eardrum. It is always better to stop and change to a larger ear tip than to proceed with a tip that is too small. Next, turn on the equipment. Press either the left or right control panel button from the test menu to select which ear is tested. The probe check and screening should begin automatically. Some equipment will indicate the progress of the test, showing sound frequencies or pitches, while others will simply indicate that the test is in progress. The display on the device may give you an error message if there's not a good probe fit or if too much noise is detected. After the test is complete, the screen should display pass or refer. Record the result and remove the probe from the ear. Next, we screen the other ear. You can typically leave the same probe tip in place to test the other ear. Be sure to ensure that it's not blocked with wax. If it is, remove the probe cover and replace with a new one. If there is any wax residue on the probe itself, use a dry tissue to wipe out and away from the base of the probe. Put the new probe cover on and screen the other ear. If a child receives a refer result in either ear, then they will need a second OAE screening between 10 and 30 school days in the future. After each child, be sure to disinfect reusable tips and discard single-use tips.